Please start.
Hi everyone, my name is Andrew Ariano. I'm with the Margarita Humanitarian Foundation. Today I will be presenting you with depression. So, introduction to depression. Most people will be affected by depression in their lives either directly or indirectly through a friend or a family member. Confusion about depression is common with regards to what depression exactly is and what makes it different from just feeling down. One must be depressed for 2 weeks to be diagnosed. Depression is the common code of mental disorders. I think that's a really good quote because it makes you think about it in a different perspective. Now, what is depression? Depression is characterized by a number of common symptoms. These include a persistent sad, anxious, or empty mood, and feelings of hopelessness or pessimism that last nearly every day for weeks on end. A person who is depressed also often has feelings of guilt, worthlessness, and helplessness. They no longer take interest or pleasure in hobbies and activities that were once enjoyed. This may include things like going out with friends or even having sex. The four main types of depression include persistent depressive disorder, which is a depressed mood that lasts for at least 2 years, postpartum depression, that is experienced by many women after giving birth. Women with postpartum depression experience full blown major depression during pregnancy and after delivery. And once they give birth, they could last for a few months as well. And it's very important to take care of because it can turn very dangerous. Psychotic depression occurs when a person has severe depression plus some form of psychosis, such as having disturbing false fixed beliefs, which are delusions, or hearing or seeing upsetting things that others cannot hear or see. Those are hallucinations. Seasonal affective disorder is characterized by the onset of depression during the winter months when there is less natural sunlight. This depression generally lifts during spring and summer. But there's a such thing called as summer depressive disorder as well. Some people tend to get depressed during the summer as well. Now, depression in the USA. The American Psychiatric Association has reported that from 2016 to 2017, the proportion of adults who describe themselves as more anxious than the previous year was 36%. In 2017, more than 17 million American adults had at least one major depressive episode, as did 3 million adolescents ages 12 to 17. 40 million adults now suffer from an anxiety disorder, which is nearly 20% of the adult population. Why is depression such a big issue at the moment? Well, these are pretty self explanatory. We have the current COVID-19 pandemic, the fears of going out and getting sick, the fear of catching it and giving it to a family member or to a loved one, healthcare issues that are currently going on. Like some people don't have healthcare, and with the pandemic, that's very important. Feeling lonely by being at home all the time, your home setting, depending on who you live with, you might not want to live there because those people are living there. Your racial division that's going on in the world, politics, climate change, and education. It's very hard for some people to study at home and they rather be on campus. All of this causes depression. Other causes of depression include environmental factors. Now, um, oh, people are now exposed daily to an array of synthetic chemicals in the air, water, and in their food. Chemical pollutants, natural disasters, and non chemical environmental stress all raise someone's risk profile for depression. Childhood trauma, long term stress, and significant loss can all trigger depression episodes and symptoms. The DSM is basically the Bible for psychologists. They currently recognize the influence of environmental pollutants on depression rates. It is common knowledge that pollutants can cause cognitive disabilities and physical health problems like asthma and cancer. And medical scientists are now starting to look at how chemical pollutants can harm mental health. And then we have the psychological aspects of depression. Those part of the brain which is in the limbic system is the amygdala. Our amygdala is activated when a person recalls emotionally charged memories, such as a frightening situation. Activity in the amygdala is higher when a person is sad or clinically depressed. This increased activity continues even after recovery from depression. And then the thalamus receives the most sensory information, which directs high level functions such as speech, behavior, reactions, movement, thinking, and learning. Some research even suggests that bipolar disorder may result from problems in the thalamus, which helps link sensory input to pleasant and unpleasant feelings. And then we have the hippocampus, which is right here. The hippocampus has a central role in processing long term memory and recollection. It is a part of the brain that registers fear. For example, when you're confronted by a barking aggressive dog, and the memory of such an experience may make you wary of dogs you come across later in life. The hippocampus has been found to be smaller in some depressed people and in people with PTSD, and research suggests that ongoing exposure to stress hormone impairs the growth of nerve cells in the part of the brain. So, unfortunately, our hippocampuses are very affected by depression and PTSD. How to prevent and manage depression? Well, I have a quote right here by posttms.com, which shows how important attending talk therapy and support groups can be an effective way to prevent depression triggers. Always avoid stressful situations and strengthen positive relationships. And effective ways to combat risk factors for depression include avoiding drugs and alcohol, having good sleep, exercising, and proper nutrition. And of course, use coping skills. Coping skills include things such as grounding yourself or using the 5-4-3-2-1 method. The 5-4-3-2-1 method is listing 5 things you can see around you, 4 things you can touch, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. Like if you had coffee in the morning, maybe you can taste the coffee that's still lingering on your tongue. Another one of my favorites is the deep breathing technique. You breathe in for 7 seconds, hold that for 5 seconds, and then exhale for 7 seconds. You continuously do that until you feel yourself very much calm down. Now, who can I talk to for help? You can always speak to your doctor or a loved one for help. Please always reach out to help. There's no embarrassment in reaching out for mental health support, and you may also call or text the helplines. The National Suicide Prevention Hotline is 1-800-273-8255, and you can even text the crisis hotline, which is texting the word hello to 741-741. And those are my references, and that is all for me. Do you guys have any questions?
Share my screen. Okay. Sorry, I have to put this in presentation mode. Okay, and today I'll be talking about depression, and I'm from the Margarita Humanitarian Foundation. So what is depression? It is a mood disorder that negatively affects one's moods, actions, and feelings. It's also a treatable disorder, but if left untreated, it can be detrimental to not only you, but your loved ones. and it is caused by an array of problems that I will be talking about in later slides. So here's just a list of depression's effects on lives. It can lead to a change in appetite, a change in sleep, suicidal thoughts, feeling of hopelessness, withdrawing from loved ones, lack of motivation, stress, and irritability. Here are just a few factors that cause depression. So it is possible that it could be genetic. So if you have parents that have experienced depression, you could end up just experiencing depression as well. Stressful events can also lead to depression, health issues, family issues, financial issues. And a big one is the pandemic that's currently going on right now. People are experiencing financial issues by losing their jobs, family issues by some people having to be in situations with their families where they're in a toxic environment. And medication can also lead to depression. There's a few medications out there that people are prescribed to treat like certain illnesses, but their side effects lead to mood swings or sadness, which can eventually lead to depression. Alcohol and drug abuse is a factor that causes depression. Alcohol is a very important one to look at because most adults drink alcohol, but alcohol is known to be both a stimulant and a depressant. So, when people drink the alcohol, they get, they feel good, but then when the alcohol starts to wear off, they end up like getting in a depressant mode, and which sometimes leads people to drink even more alcohol to upbring their positive stimulant. And it just becomes a cycle, and it can just end up leading to depression. Pregnancy is another factor that causes depression. There's a lot of hormones pre and post pregnancy that just mess with people's mental health. Personality can also be a factor that leads to depression. That has more to do with some people are introverts and they don't have the means to go try to make new friends, and that causes them to just be depressed. Here are just a few statistics of depression. So 264 million individuals worldwide suffer from depression. 17.3 million Americans suffer from depression. Globally, depression is the #1 cause of disability. Adults who experience depression are 64% more likely to develop coronary artery disease. And depression is often an outcome of other diseases. So 25% of cancer patients end up becoming depressed. 1 in 3 heart attack survivors become depressed. 50% of Parkinson's disease, people suffering from Parkinson's disease end up getting depression. And 1 in 3 individuals with diabetes end up getting depression. So now I'll talk about the different types of depressions. There is major depressive disorder that you just have intense depression symptoms for at least a minimum of 2 weeks. And you also have persistent depressive disorder, which is symptoms of depression that last a minimum of 2 years. And I just want to make a note where major depressive disorder, it's intense symptoms, whereas persistent depressive disorder, it's just consistent symptoms of depression. It doesn't have to be very intense. You also have prenatal and postpartum depression, which is depression that either comes before or after pregnancy, as mentioned before, due to different hormone imbalance. You also have seasonal affective disorder, which is a depression that can show up in the fall and winter. And this is mainly just due to vitamin deficiency, of not having enough vitamin D because it's winter and the sun's not out. Yeah, and then you also have psychotic depression, which is intense depression symptoms with hallucinations or delusions. Now I'll be talking about the gender and age difference in depression. So women are twice as likely to have depression compared to men. And this is, again, pregnancy, the post and prepartum depression of being pregnant and the hormonal changes, puberty, premenstrual symptoms, menopause, and a big one is just culture. Women have to deal with so much more judgmental things that can just end up leading to them becoming depressed. Now, the age group of depression, children it's very uncommon for them to become depressed, but it's not saying that it's impossible. If children end up being born into or like adopted into a family that's just not good at taking care of children, they can end up becoming forming depressive symptoms. Teenagers, it's hard to pinpoint whether they're depressed or not because you know kids age 12 to 18, they're going through puberty, they're like trying to figure themselves out, so they do have a lot of mood disorders. But it's important if you do have teenagers at home to not just assume that their moods are changing because of puberty, but to look into and make sure that they're not having depressive symptoms consistently. Um, Adults are actually the most prevalent out of all the age groups, which makes the most sense. They have families to take care of, trying to put food on the table. There's just a lot of stress. And senior citizens, it is the least prevalent in men above the age of 80. And it's not uncommon for senior citizens to get depression, especially considering that's when most of their health issues arise, which can lead to depression. Now, the physiology of depression, certain areas of the brain are thought to be the cause of depression. So the hippocampus and the amygdala are two major areas of the brain that focus on emotion. So sometimes people with depression are known to have smaller hippocampuses, and hippocampus deals with like emotion and memory. So that can be a big one. Another physiological reason for depression could be if brain cells begin to function incorrectly. So our brains have neurotransmitters, which are kind of just like chemical messengers that take like the chemicals needed throughout your body into certain areas of your body that need these chemicals. And these chemicals can range from helping with your memory to your appetite to your motivation. So yeah, there's sometimes in your brain the receptors that attach these chemicals either become oversensitive, causing too many chemicals to flood in, or insensitive, causing not enough chemicals to flood in, which can lead to abnormal brain activity and which could lead to depression. And excessive or insufficient amount of release of these neurotransmitter chemicals and reuptake of these chemicals when it shouldn't have been reuptaken. So again, just abnormal amounts of chemicals in your brain that could lead to depression. So there are a few treatments and preventative measures that can be taken for depression. So lifestyle changes, just exercising more, hanging out with friends more, eating better, sleeping better, which is easier said than done, obviously. But if you can make these changes, it'll be for the best. Therapy, either group therapy or one-on-one therapy, sometimes just talking about what you're going through can make a huge difference. There are medications that can be taken, antidepressants, stuff like that. And the last one is transcranial magnetic stimulation, which is just a non-invasive uh, where they just stimulate areas of the brain that deal with mood. So again, like they could stimulate your hippocampus or your amygdala to try to improve your depression. Lastly, here are some resources if anybody you know or you in general are experiencing depression. The major thing to remember is depression is not a sign of weakness, so please do not hesitate to seek help. I know depression is very taboo, mental health disorders are very taboo in this time of age, but it's very important to seek help because it is treatable. So just down below, you can see a few phone numbers and hotlines to text to seek help. And that's it. Thank you.